raise awareness of this issue and pass it on to future generations. Keep in mind, this has been going on for quite some time, and there's a lot of issues from the distant past which today are not properly resolved. Remember, back in around the turn of the century, around 1900, many people died to establish fair labor unions, just to give an example. And there are many things wrong, from the way the Federal Reserve operates. The Federal Reserve apparently isn't even a branch of the federal government, yet it prints and sells money to the government, costing the government billions of dollars. Why does the government do this? Well, perhaps to help the private bankers, large international bankers, increase their wealth. Well, that's just one part of the problem. There's many parts of the problems, and there's many problems. Often it is based on corporations or individual making wealth at the expense of others. A good example I might learn soon as I move from a mobile home into a regular house is how come mobile homes have such horrible insulation, so that people who live there, who are often poor, have to pay extremely high electric bills, where perhaps people living in a house of similar square footage would pay much less for electricity, even though they who are living in the house might overall have more money. It seems the poor are being exploited here. And I'm sure that common theme of the poor being exploited, there are countless examples of this, done in countless situations by countless corporations and conditions. Another good example is medicine. A lot of times people are prescribed inappropriate drugs because the doctor gets lobbied by pharmaceutical corporations, and the doctor promotes certain drugs, perhaps without full awareness or knowledge of the drugs or their side effects or the patient's conditions, or perhaps the doctor is simply too busy enough to evaluate and make a true decision. That's where you, the patient, should research on the internet any and all drugs you are prescribed, particularly for the elderly. The elderly who are most vulnerable to taking too many drugs and having dangerous interactions with these drugs without the doctor's knowledge. This is becoming more and more common. So, sounding an alarm of sorts, a medical alarm, for you to watch out for those who are in the hospital, and especially if you're for those in the hospital for extended times, and those who are elderly, or those with chronic conditions who have to take lots of medicine that are prescription medicines. Evaluate all these medicines carefully. Even over-the-counter medicines need to be evaluated carefully and their side effects determined. Don't take this lightly. This is very serious. Your long-term health and the long-term health of your parents probably depend on these concepts. So please don't forget them. Remember, research all medications that you are taking or your people who are sick are taking, especially the elderly. Well, so they might be exploited by accident by giving the wrong medicine simply because their doctors are too busy, because they have to have more patients, because the high cost of malpractice insurance and other conditions. Well, we all have to trust each other more and perhaps accept a little more personal responsibility for what we do and the situations which we undertake, realizing that we are taking on risk and we have to accept the risk and pay for the risk ourselves. If we adopt that attitude, typically that will drive down the cost of a lot of activities. Let's give the example of snow skiing. I love to snow ski, but if you hold the slope and the slope operators firmly responsible for all slope conditions, which often change rapidly. So if, in other words, if a skier hits a patch of ice and has a severe wreck and severely injures themselves, is it the skier's fault or is it the ski slope's fault? Well, I'm sure it's all debatable, and of course depends on the actual ice patch and how long it was there and so on and so on. All I'm saying is, if we adopt the attitude that it's the skier's fault more often, then the cost of skiing will be driven down. If we adopt the attitude that it's the ski slope's responsibility to keep everything perfect, and if we have a wreck, we could sue the ski slope for millions of dollars or thousands of dollars for medical bills and whatnot, well then the cost of skiing is going to go up. Well, similar logic applies for all conditions. So sometimes it's better to adopt a little more personal risk or accept more risk for yourself and be more responsible for yourself and your own actions.